Hello, listeners. Yamina here. Welcome to the Dr. GPCR podcast. As we return to a regular programming after a fantastic 4 series episodes honoring Dr. Mark Caron, we would like to take a moment and thank our Dr. GPCR Ecosystem partners for their support. We'd like to thank Domain Therapeutics, GPCR Therapeutics, Design Pharmaceuticals, Montana Molecular, and Orion Biotechnology. We have a few announcements to make. We want to let you know that we are revamping the Dr. GPCR Summit, which we ran from 2020 to 2022, and are launching the Dr. GPCR Symposia events. With this series, we aim to bring you, our ecosystem site members, regular and topic-specific virtual free live events. The first symposium of the series will be held on Friday, March 24th, starting at 8 a.m. EST. We will host a full day of talks on Zoom and a 2-hour poster/networking session on Wonder. The topic of this event is recent advances in understanding challenging GPCRs. Our confirmed speakers include Graham Milligan, Ines Liebscher, Ben Myers, Antonella DiPizio, Lucas Gratz, Jake Mahoney, Brendan Wilkins, and Anthony Boucard. All trainees are welcome to come and present a poster. There won't be any poster selection. Everyone is welcome. For more information and an updated schedule, you can visit the ecosystem. The easiest way to get to it is to use the links in the footer and look for Dr. GPCR Symposia. You will be able to join us by marking your calendar and becoming a Dr. GPCR Ecosystem free site member. After the event, and if speakers give us permission to record, you will also be able to watch these videos with your premium membership indefinitely. To navigate the ecosystem and find more information about our new events and everything that we do at Dr. GPCR, please use the direct links in the footer to navigate the website. And now, let's dive into this episode. Hello, everyone. This is Yamina from Dr. GPCR, and this morning it's 6 a.m., and I'm excited to have with us our guest today, Dr. Raul Gainetdinov, and he is currently located at the other end of the world, where it's 3 o'clock in the afternoon. Hi, Raul. So nice to see you and to meet you.
Nice to see you. Yeah, I'm very happy to talk to you today.
I'm very excited to have you on as well to give our audience a little bit of context. You worked with Dr. Mark Caron, and today we're here to talk about your work, and how Mark's work and Mark's, I want to say, orbit influenced you and your career. So why don't we start with a series of introductions, and if you can tell us a little bit more about yourself and where you are today.
Yeah, I'm graduated from Second Moscow Medical University in Moscow, and then went to Institute of Pharmacology and started to work with Professor Kirill Sergeyevich Raevsky, by the way, a very good friend of Mark, who was working on dopamine receptors. Okay, that's why I'm not GPCR person per se. I'm dopamine person, and I was working on PhD thesis on dopamine, role of dopamine autoreceptors in effect of antipsychotic drugs. And I was using neurochemical techniques such as microdialysis and measurement of dopamine. And I was working in Moscow and got my PhD there on antipsychotic topic. And as you all know, all clinically effective antipsychotics are blockers of the two subtype of dopamine receptor. And then Kirill Sergeyevich Raevsky, my former mentor, introduced me to Mark Caron. That's how it started. It was 1992.
Wow. But before we talk about what happened once you got introduced to Mark, how did you end up in science?
Actually, I'm graduated from department. It's called Medical Biological Department of Medical School. So I'm a biochemist, medical doctor biochemist, without right to cure patients. So
Uh-huh.
I'm scientific, the medical doctor. So this is very, very special department in our Moscow State University. And we were prepared to do science, medical science. And actually, I didn't know where to go when I was graduating in 6th year of medical school. Just my friends said me, oh, there is one institute where they're working on dopamine. I said, what is dopamine? I didn't know anything. I knew a little bit, but not much. And I ended up being in this lab and started to work, and it was so exciting. So I got involved and cannot stop anymore. Now I'm continuing this dopamine all my life, and it's my major topic of interest. And I end up being with Mark as the greatest researcher in dopamine field. Yeah.
I think we all need a little boost of dopamine all the time anyway. So I think it's a great,
But
great.
probably not many people realize that Mark's greatest achievements, in fact, not in GPCRs, it's in dopamine. No,
Yeah.
people know a lot about his contribution to GPCR field, but contribution to dopamine is amazing. You know, he's a Mr. Dopamine. He was Mr. Dopamine for many
Wow.
years. Yeah,
That's
he's a
fantastic. Please go ahead.
you know, being a classical pharmacologist, of course, I didn't know much about molecular biology or anything. You know, we did normal pharmacology studies, but I ended up being introduced to Arvid Carlson. Arvid Carlson described dopamine in the brain, so he was Mr. Dopamine before Mark Caron. So,
Wow.
and I, before coming to United States in 1996, I already met Professor Arvid Carol. I was Arvid Carlson. I was already friend with him, and then actually he wrote my recommendation letter to Mark about me when I got a lab. So I came to Mark's lab not because of GPCRs. I came because of dopamine, because I
Dopamine.
believe that this is a dopamine mecca. It's the best place to study dopamine, and that's what I was thinking in 1996 when I joined Mark's lab. That's what I was thinking in 2007 when I left Mark's lab. That's what I'm thinking now. It was the best place for last 20 something years to investigate dopamine. And Mark Caron is Mr. Dopamine for me forever.
That that's fascinating. Before we go back, I'm really curious to hear more about, your scientific interest or your interest in science in general, as for example, a child or as a teenager. Was there something in you when you were growing up that, got you interested in science, which landed you in that very special medical program and then into the dopamine field?
Oh, I should say this is a very strange thing. When I was 14, 15, I actually, I grew up in medical family. My mother is a doctor, my father, all my uncles, all my aunts, my brother is a doctor. Everybody is a doctor. So, and I was thinking what I gonna do. There was no question, of course, I was should be doctor. There is no question. I should be medical doctor. But I all the time was thinking that I want to be medical doctor, but not in clinic. I want to be investigator. Okay,
Yeah.
and that's end up who I am now. I'm director of the Institute of Translational Biomedicine. I'm not seeing patients. I'm inventing something for medicine. And it's amazing, like when you're 14 and you want to be investigator, medical, but investigator, not clinical doctor. And that's what I am now. It happened enough. Strangely enough, I got enrolled in this very, very special medical school. Strangely enough, I graduated and ended up being involved in highest level science because of Mark. It's top level in the world. And continuing it. It's strange, but it happened when I was 14.
I think
Everything.
it's I think it's very rare that people at 14 or, teenagers know ahead of time what they want to do. And it's such a blessing, but at the same time, it's not the majority of us. I didn't know what I wanted to do at 14. I think a
Mhm.
lot of us, a lot of the audience did not know that. But I really applaud all of those, including you, who knew what they wanted to do, followed up on it, and they still love they don't regret the decision and they're still in the field that they chose for themselves.
Yeah.
So you mentioned having your previous mentor send a letter of recommendation to Mark, and you've heard about him. Obviously, you were in the dopamine field, but what was it like when you first spoke to him?
Okay, that was very interesting story. In 1992, I received my PhD thesis, as I told you, about the role of presynaptic dopamine autoreceptors in the effect of typical and atypical neuroleptics, now they called antipsychotics. And my former mentor, Kirill Sergeyevich Raevsky, invited me to visit dopamine 1992 meeting in Sardinia. Okay, and I went there and to see all these big guys in dopamine, and it was, and I came there. And Professor Jessa, Gianluigi Jessa, head of the Department of Pharmacology in Cagliari, he actually invited. It was 1992 in Russia. We didn't have money, Don't forget, we had no money at the moment. So Italian colleagues invited me there. I'm just graduate. I just received my PhD, and I'm coming there, and then I suddenly see all these great guys in dopamine. All these Swedish, Italian, American guys whom I read all articles, and suddenly I see them. It's my first visit abroad. And I'm in the middle of this dopamine biggest conference in the world. Like 300 best persons in dopamine, and I immediately recognized the leader there. It was Mark Caron, because he was sitting in the first row, and there was two population of people on this meeting: people who study behavior pharmacology, okay, it's classical pharmacologist, and molecular biologist. Who it was time of cloning of dopamine receptors, and as you know, Mark cloned 2 dopamine receptors out of 5. They all GPCRs, of course. That's how Mark was growing in dopamine field, because he's the best GPCR guy in dopamine field. And he immediately recognized in like 20 minutes who is the leader, because Mark was asking questions, and he understood these questions, both to pharmacologists, in vivo people who work with mice, rats, and to molecular biologists. So these two groups of people, they all were listening Mark. Mark was the only one person who can judge, and in vivo and in vitro. And I was sitting and saying, who is this guy? I was really surprised, because I didn't know GPCRs field at the moment. I was pharmacologist, and I knew Carlson, I knew a lot of guys who discovered dopamine, who studied pharmacology. But Mark, I said, wow, this is really, really serious person, because he knows everything. And he really understood everything. And I was really impressed. In 20 minutes, I said, wow, I like Mark, I was not introduced yet. But in evening, my professor, Kirill Sergeyevich Raevsky, he had a trip. He brought Armenian cognac, there. And he organized a party in evening in our room, and Mark Caron was invited there, and everybody was invited, and they tested Armenian cognac. At the moment, nobody knew what is Armenian cognac in the West. It was only in Soviet Union. And they all tested a little bit cognac, and then I was introduced to Mark, and we started to talk. My English was terrible at the moment, I don't know what I told him, but that was how I met him. And it was the first meeting in 1992. Then I spent like a couple of months there in Italy, learned the microdialysis technique with Asuti Prata, and then returned back to Russia and continued to work in Russia for 4 more years. Yeah. Meanwhile, it was another meeting, second meeting when I met Mark. It was in dopamine 1994. So at the moment, every 2 years, all big guys in dopamine were meeting, because it was cloning time, the discovery of dopamine receptors. It was classification time, because nobody knew how to name these dopamine receptors. And in 1994, it was in Montreal in Canada. I just it was crazy time in Soviet Union, Russia. Everything was being destroyed. At the same time, a lot of opportunities. So I wouldn't tell you how I earned my own money took $4,000 in my pocket because university cannot give me anything, and just went there as a tourist to Dopamine 94 meeting because I couldn't miss this meeting. I wanted to see Mark again, everybody, Arvid Carlson, everybody. I wanted to see all these big guys in my field, and I just paid from my own pocket. And I went there, and again, we met with Mark, we talked, we discussed, and I should say, I was witnessing how the name of dopamine receptor appears, D1, D2, D3, D4, D5, because there was fight between Mark Caron group and Phil Simon group, how to name dopamine receptor. Dopamine was suggesting to name like serotonin receptor, 5-HT1A, 5-HT1B, 5-HT1. So Mark was planning to name D1A, D1B, it's D1, D5, and D2A, D2B, D2C, D2, D3, D4. But he lost this battle against Phil Simon. And I was witnessing it. And it was a committee for dopamine receptor nomenclature from International Union of Pharmacology. And it happened to be that I was the first guy to learn about that because I came to dinner and it was only one table empty. All the tables were already taken. And I sit there and suddenly committee comes and sits on my table. Mark and everybody, Phil Simon, everybody. And they continue discussion how they named dopamine receptors, okay? And I was shocked, young guys sitting and the people describing how they named D1, D2, and Mark admitting that he lost, like Phil Simon made this suggestion, D1, D2, D3, D4. I was really shocked. I'm sitting in a table with biggest guy in dopamine field, and Mark is there, and Arvid Carlson is there, Phil Simon there, and they discussing with me, and I just by occasion I was on this table, I was the last guy to came, and the only one table was open, this one. And I really was really thrilled because I was in a history time, and it's crazy, but now I'm a chairman of this committee, of dopamine nomenclature committee. Yes, now I'm. Mark should be, but he never wanted to take these responsibilities, and he pushed me there. So at the end, now I'm a chairman of International Union of Pharmacology Committee on dopamine receptor nomenclature. So if somebody will discover 6 receptor, and Mark is in the committee, of course, I invited him, I invited everybody, all these big guys now in the same committee, but unfortunately, many of them already gone, but if you take my name, you will see all this committee. Mark in the committee, of course, certainly.
Wow.
And forever will be there, as Arvid Carlson, so the past members and present members.
You touched on so many points. I want to just take a little step back for our audience and say that what you just mentioned about Mark sitting at the front at conferences was also discussed in the panel discussions that we had. And everybody was saying that, you'd think that he'd sit in the back. No. He was sitting in the front and he was asking all sorts of questions all the time. And the person that mentioned this initially, I think, was Michel Bouvier. And so I trained in Montreal. I trained at the University of Montreal in the orbit of the Bouvier lab. I wasn't in the Bouvier lab. And I always thought that Michel was the type of person who could sit throughout any type of presentation and still focus and ask specific, very important questions. And turns out that he learned that from Mark. Yeah, which I thought was a really...
that was amazing. It's in 20 minutes, it was clear who is a major person in the hall, because the only one person can ask, okay, let's see that someone transmembrane domain, you have some mutation here. And then, did you test this behavioral test? Nobody could do that. Nobody at the moment. In 1992, later people learned it when knockouts appeared, okay?
Yeah.
But it was 1992, 1994. Nobody could do in vivo and in vitro at the same time, molecular biology, behavior. Nobody, only Mark could do that.
And there was also please.
Yeah.
So
no, but I'm sorry. That's why, I was seeing him. Again, we had 94, again, Cognac, Armenian Cognac.
Of course.
Yeah. And again, I talked to Mark, and Mark knew me, and that I can do microdialysis, neurochemistry, behavior, and that's how I've met 2 times. And how it happened. Should I start talking how I arrived to Mark's lab?
Yes, but before we do that, I just want to kind of make another point as to and tie it back to the panel discussions we had. And we were talking, I think, with the second group that worked with Mark during the same period as you did. And somebody mentioned that at the time in Mark's lab, everyone had a different project. And yes, it went from pharmacology to cloning to animal models. And I made the comment that Mark 20 years ago already had a pipeline developed in his lab where it was all around the same topic, but everyone used different models, different technologies, different techniques to answer high-level questions. And we all concluded that this was so unique in academia 20 years ago, but it is still unique in academia today. So in that aspect as well, he was a pioneer.
I absolutely agree with you, because the paper what appeared in 1996, Bruno Giraud paper on dopamine transport and knockout mice. It was a revolutionary paper in many aspects, and one of the aspects because it was so thoroughly done, and biochemically, and voltammetry, and biochemistry, and behavior, and everything. Because I think it was the first paper what I've seen which was characterized knockout mice so thoroughly, so under different aspects. It just established a new level for papers. It's a little bit even too much, because after that it become very difficult to publish anything. It was so high level. Now everybody compare all papers to this paper, and it created a lot of problems for us. Before this paper, it was much easier to publish something in Nature or Science. After this paper, I mean, the level is so high, so you have to really, I mean, from one side it's good, but from another side, we will never beat records of Mark. Mark published 700 papers. It's impossible today, just purely impossible, because the criteria is so strict now for publications.
Yeah.
We never can beat that level, so that's forever. I mean, this is a golden time of pharmacology, biochemistry, neurochemistry, everything. We never will be able to beat that level.
Absolutely. So it was clear for you that after meeting Mark twice at the dopamine meeting and really identifying him as the guy who can answer all sorts of questions, whether it's pharmacology or animal models or physiology, you wanted to go and work with Mark. How did that happen?
Yeah, how did that happen? Actually, I already had a group of people, 4 people were working with me. I already was postdoc, not postdoc level, assistant professor level, in fact, in Russia. And I really didn't want to go anywhere because I was able to make some money extra. I'm not going to tell you how, but it was a crazy time destroying the Soviet Union. It was a crazy time. So, but my group fell apart, and I started to feel that I'm alone. And I said, "Oh, probably it's time to go somewhere." And the only lab which I wanted to go, it was Mark's lab. So, in fact, I wrote one application to Mark Caron. That's it. And suddenly he invited me, and I was really impressed because he met me twice, and we already kind of he knew me, I knew him, and suddenly he said, "Oh yes." And the story is like why he took me, in fact, because Bruno Giraud paper, that knockout, dopamine transporter knockout mice. And when I wrote, I didn't know that this paper was published. I was in Russia. I didn't had a quick communication with international literature. I wrote this just because my lab was being destroyed and I wanted to go somewhere, but I wanted to go to the best lab in the world. It was Mark Caron's lab, obviously. And Mark thought that I wrote him because of this paper of dopamine transport. But it was funny also. I really didn't understand where Mark is located. I thought he has second lab in Canada, in Montreal. I thought, and I wrote him a letter. I said, "Dear Mark, I want to join your lab to work under your supervision, but I prefer to work in a lab in Canada." I imagine how he was laughing because he didn't have lab in Canada. He had it only in Durham, in Duke, and I didn't know about that. I thought he has two labs. I thought one in Canada, one in the United States. But I wanted to go to Canada, not to United States. I don't know why, but I wanted to go to Canada. But it ended up he took me and he thought that I am joining because of dopamine transporter knockout mice, whom I learned only 3 months later. On the way to United States, somebody showed me this paper, said, "Wow, what a cool story it is." And of course, I'm a dopamine person, and dopamine transport knockout mice is the best in vivo model for dopamine physiology, neurochemistry. Of course, I got. And why Mark wanted to take me? Because he needed somebody to measure dopamine in dopamine transporter knockout mice by microdialysis. And I was the guy who was doing microdialysis studies. And it's funny. If you check now, knockout mice, microdialysis, my paper is the first with Mark. Nobody
Wow.
did on mice, knockout mice, microdialysis measurements of dopamine before us with Mark. We
Wow.
did it in dopamine transport and knockout mice. Before I was studying on rats, everything was done on rats. Nobody was using mice because
Nice.
knockout mice were just appearing, and we were starting to do it with Mark. In fact, it was first paper.
I think it's fantastic. And I want to make a couple of points here for the audience. So we're talking here, it's the 90s, early to late 90s. Email is not an
96.
option. You
No,
sent
it's not an option.
you
Yes, we
sent
did.
letters.
We sent letters. Yeah, it was by mail. Yeah,
Exactly. Phone calls were not an option either because it was so expensive to call. This is the
yeah.
time where, well, I grew up in Romania, and this was the in around that period, and this was the time where you waited after 6 p.m. to call anyone, because after 6 p.m. it was cheaper to make a phone call, and it was a yes or no phone call. You wouldn't spend too much time on the call, and getting access to scientific papers. I think at that time there was no PubMed. You can go online and download the
Yeah.
paper. Libraries were not well equipped. And just to give one last piece of context, growing up in Eastern Europe, movies that used to come out in the US took years to get to our side of the world. And
Mhm.
4 or 5, 6 years, not like now where it comes out here in the US and it comes out in Europe and everywhere, and you can stream it. So just to give the audience the context of the difficulty to get access to information and connect, where it's not today's connected world.
Exactly, you're absolutely right. But one good thing because of that, because we have limited capabilities to get this information, I pretty much memorized every paper what I have put the get on. I was reading like crazy all these papers. Whatever I can get, I was reading, and Mark kind of appreciated that because when I came there, he said that I read more other people because they had easy access. I had difficult access, and
Yeah.
so I really appreciated the opportunity to read these papers.
Yeah.
That's true.
So
True.
how was your move to the US?
It was not easy, I can tell you. I came to Mark's lab immediately. Realized that it's Mark's lab is part of the bigger ops GPCR world, and contribution. Because I honestly tell you, I came because of dopamine, not because of GPCR.
GPC. That's great.
I'm dopamine interested in dopamine. And then suddenly I realized what kind of the world, this huge field of GPCR's contribution of Mark, how huge it is all, that's, of course, scientifically, I felt myself in paradise, but lifestyle United States is so different from Europe. as you imagine.
Yeah. Yeah.
It was not easy adaptation, but at the end it worked well. Yeah. So we started to work. But those scientific, it's came time of knockouts. One thing I should tell you, before this Bruno-Giraud paper in 1996, in neuroscience, in pharmacology, nobody seriously considered knockouts. It was something what immunologists developed, who knows, some molecular stuff, who cares? I don't know, nobody really believed it. The Marx paper, Bruno-Giraud paper, it convinced many neurochemists, pharmacologists that knockout mice are greatest models for pharmacologists to investigate now. Not pharmacologically, but genetically, we can modulate function of gene and to do something to investigate what we couldn't touch before. So dopamine transporter knockout mice became, I mean, it was and it will be probably the most popular model in neuropharmacology forever. And now we develop rats, but it's just a little bit small step further, but in general, it's the same idea. And this is the greatest model. And contribution of Mark to neuropharmacology is amazing. That's what many people do not appreciate. You know, I'm as a pharmacologist can tell you, in pharmacology, Mark is at unbelievably high level. You know, everybody admires him, you know, because of introduction of in vivo models too. It's huge.
Yeah. Yeah. Well, in the three panels that we had recorded with these 30 people we spoke to, that's what came through. So the couple of things that came through around Mark is that he was a pioneer on so many levels. You know, he had the pipeline developed in the lab. He was working on different models. He used to go to so many meetings. Apparently, he had his passport with him all the time. And the
Yeah.
people at the airport knew him by name, and he knew their names as well. And
Yeah.
this contagious love for science was definitely felt throughout the lab. So my next question to you is, what are the things that how was working in the lab with Mark? What did you learn, not scientifically, but also as a person?
What I learned from Mark, not being afraid of new questions, new technologies, nothing. You know, if you have to do something new, do it. That's it. Nobody. I mean, it's not like we were working before in pharmacology. Okay, I know like 5, 10 techniques, and that's it. And I'll stick to them. I'm very good in them, and I'm not going left and right. And in Mark's lab, you come and say, oh, "Why don't you do that stuff?" And I said, "I never did it." Okay, try. And you immediately learn to do something what you never done. You know, you're never afraid of new approaches and new topics, new directions, new. I mean, it's helping me a lot. For example, as I told you, just small example. Last year, I published 3 papers on oncology. I never studied. I never did oncology research before, but it ended up being like dopamine, trace amino associated receptors are important there. So I end up studying oncology now. You know, that's something what I learned from Mark. You know, it's that like you never stop on what you know. You keep going in any direction, whatever field it is. You just go there. You know, if your topic dopamine is important for oncology, study oncology. So that's it. It's exactly Mark's style. That's exactly what I learned from him.
I love it. If you were to come up with a few words around describing Mark's top qualities, we've had generosity, we've had curiosity, we've had a lot of nice words describing Mark's top qualities, and I'd like you to focus perhaps while on the qualities that you found the most inspiring and that you took on, like for example being not being afraid to ask new questions.
Yeah, that's one thing, and nothing dedication to science. I mean, it's obvious was, you know, you talk to Mark, whatever topic you take, it will end up being we discussing science. You know, dedication. So he is a scientist, super scientist, whatever. You know, I'm sure It was forever. It was all the time until last days like that. I'm sure Mark can talk only about science. That's his major dedication. And second thing, curiosity. Really, he was very curious. He was very curious, and again about science. It's not like about opera. I mean, of course, he liked fishing, for example. I know that's something, but still, science is. Just everywhere around him. He's so in love with. He was so in love with science, and it was contagious. I hope I will be the same,
Yeah, well, honestly, I think it is contagious because your enthusiasm is just coming through right now, and I think it's kind of it feels like it comes from what you learned from Mark. You already
Yes, yes.
loved the dopamine field, but spending time in the Quran lab really just boosted it.
It was 12 years of unbelievable. I was in scientific paradise. Mark, Bob, all these great people
Yeah.
around me, all this team of professionals. We had at the moment, if I correctly remember, 46 knockout mice, different 46 strains. Just imagine. I mean, this is scientific paradise. And Mark was able to keep this pipeline. I mean, I know it's impossible. I mean, nobody will ever have this kind of 46 strains of knockout animals. I have 9 now.
Mhm.
9. It's probably max who I don't know whoever has it now. But Mark had 46 strains. And we had any idea you have in the brain, okay, let's go and check it. Take this strain and check it. Maybe it will work or not. And one thing also Mark was, he was giving us opportunity to test any crazy idea what we had. 46 strains of mice. You any idea? You go and take them and test your idea if it's working or not. Try. It's so amazing situation was. And that's what Mark was never prohibiting us to try new ideas. He was encouraging us to do. So he was giving us opportunity. I mean, we test something. If it's working, then you come to Mark. Mark, I think it's working. Let's try continue this field. And Mark, oh yeah, let's do that.
I love it.
That's how it was. A lot of papers we published with Mark. That's how we did it.
Some
And
what if you were to give us a top three of the accomplishments or of the work that you've done with Mark, what are you the most proud of from your time in the lab?
no, just with dopamine transporter knockout mice, I think we published with Mark about 80 papers or 90 papers. So I would put it as a separate achievement. Work
Of
on
course.
dopamine transporter knockout mice. We published a lot of papers with Mark on that. Second thing with Martin Baliu and Mark, we discovered this AKT-GSK3 pathway of D2 dopamine receptor arrestin mediated signal. And that was mostly Mark and Martin Baliu. I just was helping them as an in vivo person to do it because we proved it in vivo. Everything was done in vivo. And third thing, what I would say, what I'm, I mean, one part of work, it's role of beta arrestin in near-period signaling with Laura Bone. We did this work, but it's mostly Laura Bone, not me. So I will not take that as a credit. Probably something what I already continued after Mark, but we started with Mark. It's trace amine-associated receptors.
Mhm.
This is a field what we published with Mark, some small commentary. It was discovered in 2001. We published a commentary in PNAS. We were reviewers. Now I can say that, and this is, I believe, is a huge field which is coming now. It's the last group of biogenic amine receptors, GPCRs, which
Yeah.
remain to be characterized, and the drugs are being developed now. And I'm heavily involved in this field. But we started it with Mark. It was originally we started in March in 2001, and then I left in 2007 to Italy, continued topic there. But we started it with Mark.
Wow. That's amazing. I have maybe two or three more questions. How about before we move on to what happened to you, where did you go after leaving Mark's lab? I wanted to ask if there were a couple of things you could share with us that junior scientists in either in the dopamine field or in the GPCR field should know about Mark, in your opinion. What should they know about Mark?
What they should know about Mark. With Mark, everything was possible. Any topic, any idea, any direction could be achievable. You can get new knowledge. It's a scientific curiosity without limits, I would say. That's Mark. With Mark, I mean, I don't know. We did so many interesting stories, which came out of nowhere, out of some speculation, out of some observation in my. I mean, Mark was giving us encouragement to follow any crazy idea. Well, that's a good thing, Scientists should develop. Scientists should go beyond borders. And with Mark, you felt it that you go somewhere else, and that's what I'm trying to teach my kids now. I'm not giving them idea. Like Mark was not giving me idea. I'm giving them mice. Okay, take mice and find something interesting, cool,
Yeah.
new. And the guys are finding it and then coming to me and saying, "Oh, Raul, I found something. This is really." I was like, "Oh, great, let's continue." And then I started to advise them, maybe you should do that, maybe you should do that. But ideas coming not from me, ideas coming from them. And Mark was giving us this opportunity. But as I told you, 46 knockouts train Mark. Mark probably don't even remember all these trains, what he had. But we remember, okay? And we said, let's try that one, let's try that one, let's try that one. Let's see how it's working. And Mark was giving this opportunity for us to grow as a scientist. Okay? And that's the greatest thing. I mean, because you cannot control scientists every step. Say, I'm genius guy to do that, do that, do that. No, it doesn't work this way. The guy should find something and then come to more experienced supervisor, and supervisor will say, no, don't go here, go there, go there. This should be improved here, there. You see, and then
Yeah.
we are getting what we got, hundreds of papers together,
Yeah.
that's it. And I'm very proud of these papers.
Of
They're
course.
a little bit even not disappointed, but with Mark, we published so good papers, as I told you. Now it's difficult to beat these papers. That's the problem we have now. It's impossible to beat these papers, and so it's very difficult now to publish something. So we established the highest level with Mark, with Bob. Bob also contributed, of course. We cannot, but we but the level of papers is so high that now it's like looking at that. Oh yeah, no, I'm not going to even try to publish something in PNAS. It's impossible. Up, impossible. I go low level because I cannot beat these papers.
Yeah.
It's simple like that,
Yeah.
and money wise, and intellectually wise, and technique wise, and it was a golden time, I consider. In
Yeah.
neuropharmacology, it's a golden time. I mean, I don't think now anybody can do that in the world.
It's it's much more difficult, but based on what you were saying, there were two important things that were happening at the time in the lab. One is that as a trainee, you had the opportunity to work on anything interesting that you wanted, and then you got the support and the mentorship. But the idea, you had to present the idea, which allowed you to and enabled you to read broadly, and then you had the tools and the support that Mark offered as a mentor. And I think that's very valuable. Um,
Yes.
we've talked a lot about work in the lab, but I know that in the lab, it wasn't always work. There were fun times in the team. And I've heard a couple of stories. Do you have any stories that you can share with us about a time where you worked with the lab and you did something fun?
Wow. No, of course we had fun, but what I like, we had great meetings in Mark's house. He had a lot of. We all were going there, meeting and talking to each other, and having good drinks, and it was greatest time when we visited Mark's house. In the lab, what I really liked, we were very good friends. I mean, all people whom I was working for 12 years in Mark's lab, they're all my good friends, and it helps a lot. Because now we submit papers, most likely one of my friends will pick up as a reviewer. So it helps, to get good friends. I mean, they're great friends. And sometimes we were like, what I remember, we were having some spontaneous parties, like 8 p.m. I'm at work, we are working, Martinsky, Alisa Lapur, of course, my great friend. Aliski, Martinsky, all these guys, we are working together. And suddenly I said, guys, let's go to our home and call Tatiana, my wife. Tatiana, please cook something. And we are coming at 8, 9 p.m. Tatiana like quickly cooks something, put wine, and we are like having spontaneous parties. I think that was fun, not planned ones. When just we tired 8, 9 p.m. We already did a lot of experiments. I said, let's go to have a drink.
Yeah.
Tatiana very quickly, Tatiana Sotnikova, my wife, was very quickly preparing something. As we thought she was cooking Italian food. Before we moved to Italy, we thought she's cooking Italian food. No, we learned that it was not Italian. It was imagination of Italian food.
Well, that's an easy solution. And I really liked to hear more about when people would say, Friday night, Mark would say, well, have a good weekend, see you tomorrow. Which was,
I think, saying it every time, but the most funny part, I was on weekends usually at work.
Well, when it's not work.
First 10 years, I would say he was also at work. Later on, he was a little bit having some time. But first 10 years, we are meeting each other on Saturday, Sunday at work.
Wow.
See you tomorrow. It was not a joke, actually. It was not a joke. First 10 years, it was not a joke.
Wow.
And we were meeting each other.
That's what came through, is that you would be there. And there was I think there was Josh Snyder, I think, who was on the previous podcast, who asked Mark around, what's the schedule. And I think Mark said, you know what, I'm already famous, it's for you. So if you come to work and you do the work, you're going to have the rewards, which is, advancing science and getting the publications. And this is kind of the running gag of have a good weekend, see you tomorrow.
Yeah, no, but it was house joke for me.
Yeah, of course.
For Mark too. He was like, anyway, at work. Oh, with Mark, one thing I can tell you now. What was funny story? Probably it will be interesting to you to know. One time we were developing PSD95, role of PSD95 in dopamine receptor signaling. We found some alterations in PSD95. Postsynaptic density 95 protein, glutamatergic protein modulating glutamatergic synapse in dopamine transport knockout mice. And we had to be doing, standard is high, we need now PSD 95 knockout mice, okay? Not full, but heterozygous. And to see how cocaine is working. And we got this mice from UK, but they were not SPF mice, standard pathogen free. So we couldn't put it in our vivarium. So we end up putting it in Mark's house and did experiments, in the Mark's house. So we were going there, we brought equipment, and we were doing experiments in Mark's house. By the way, cleaning his water pool, because it was coming, trees have fallen. We were cleaning that and doing experiments in Mark's house for like 2 weeks. Did experiments and paper published in Neuron. I mean, of course, it was violation of all rules possible.
Yeah.
But yes, that's what you can do, just bring home equipment, bring mice, and do experiment there, because you cannot do it at work, that's it.
Yeah. Yeah, I've heard stories about frogs that needed to be given in water and all sorts of things that were happening in there. But I think it's just a testament to the dedication to science.
Yeah. It's just, he that's it. And it's paper in Neuron, very greatly accepted paper. Yeah.
Wow. So uh, after the 12 years in Mark's lab, what happened next? Where did you go next?
I wanted to go to Europe. I'm still European person and I like European culture and I wanted to go. But in Russia at the moment in 2007 was no opportunity to work at all. And so I ended up being in Italy, Italian Institute of Technology. I received my lab and I started to work there. And the major topic became dopamine, of course. I developed their dopamine transport in knockout rats and trace amine associated receptors, stars. I took this topic from Mark's lab. Nobody was able to continue it. Like, it all depends on postdoc. Somebody didn't want to work on that, so I ended
Yeah.
up being in this field with me. And I received support from Hoffman LaRoche. And with Hoffman LaRoche, we did a lot of like 40, 50 papers on this topic. And now it's two compounds being developed, phase 2 and phase 3 clinical trials. And topic is developing very, very well.
Hmm.
And there are 6 receptors, and first one is already in clinical trials, drugs, and others are still experimentally. But now, after working in Italy for 7, 8 years, I found a way to return back to Russia.
Hmm.
And I started my lab, my lab. I have a couple of small labs, but now it's only major one in St. Petersburg State University. It's the oldest university in Russia. As you know, Moscow State University, St. Petersburg State University, and I've got lab, then I became director of the Institute of Translational Biomedicine. And we are working here now. We created a colony of the same way like Mark. Mark had 46 strains. Now I have 9. But believe me, it's
It's a
not
lot.
many people can say that they have 9 strains of knockout rats or mice and
Yeah.
rats.
Yeah.
It's but after Mark, I can see the 9 is not too much, but at least I have 9 strains of knockout animals, various mutants, and we are working here, and so far it's going well. We'll see.
That's
So far
great.
it's going
That
well. Yeah.
that's really fantastic. Any additional advice to junior scientists when it comes to contributing to science from your perspective?
From my perspective, to young
Yes.
scientists, yes.
Yes.
Uh, I mean, one big thing what I've learned from Mark and from Bob too, it's to be friendly to each other. You know,
Yeah. Yeah.
that's the most probably friendly lab whatever I've ever heard and ever been. We are we were even if we're critical to each other, we were remaining friends. Okay, we were like just friendly criticism, very friendly, and this is the style of Bob and Mark. I mean, to
Yeah.
be extremely friendly to each other.
Yeah.
So never put person in the position that he should explain something what he doesn't know. You kind of suggesting maybe this is story, but not pushing it too much. That's very friendly way of criticizing. That's Mark's
Yeah.
style, and that's what I'm teaching my kids now too. To be friends. We are not, and I think Mark said that. Maybe Mark, maybe somebody else. I don't know. So we're in science. We're not too much money. We are doing so. Why we should be nasty to each other? We are not in business, where they earn tons of money, doing in company work, whatever. We are doing science. We should be very very gentle to each other, very very friendly and helping each other. We should be helping each other, and that's what the major I think lesson from the Marx lab extreme friendly relationship. We are not making money. We are doing something interesting for humanity.
Yeah,
It sounds so strong, but that's it is. We are gaining new knowledge. I mean, I'm not gaining knowledge for Russia. I'm gaining knowledge for whole world. Okay,
yeah,
I finding something and giving it to people. I publish paper. Take it, please develop it. Something. Maybe you find something new after me. You know.
exactly.
Maybe my idea will help you to do to move next step, progress in humanity, and that's what biggest lesson from Mark and Bob. Never put person into position that he should be trying to hide that he doesn't understand something. Doesn't try to help him, give him hint,
Yeah,
and maybe his person. Oh yeah, maybe that's what it is. You know, that's Mark's style, and I like it very much. And I'm trying to keep it and to continue to give it to my kids that they should be friendly. First thing, friendly. Never be nasty to each other, please.
that's amazing. That's amazing. Was it? I'm sorry, I didn't want to interrupt you.
No, but that's it. I guess that's the
I,
major.
I think I think that's a great way to end here. And thank you for your time and for your contagious enthusiasm. Thank you so much. It
You.
was such an amazing. Thank you, Raul, for your time and for sharing all these stories with us. You had a very interesting, circle coming from Russia through the U.S., through Italy, and then back to St. Petersburg, all, riding the dopamine wave.
Thank you very much. Yeah, thank you. It was a great pleasure talking to you. Yeah, thank you.
Thank you so much. Thank you for joining us and listening to this Dr. GPCR podcast episode. We would like to thank our guest, as well as take a moment to thank our team members, Attila, Ines, Monse, Ivana, Andreina, Balint, and Julia. A huge thank you to our ecosystem partners for their support: Domain Therapeutics, GPCR Therapeutics, Design Pharmaceuticals, Montana Molecular, and Orion Biotechnology. You can connect with our partners directly in the ecosystem, so don't forget to join the Dr. GPCR ecosystem today. Please subscribe to the Dr. GPCR newsletter, find us on YouTube, and if you're like our podcast, leave us a 5-star review on Apple Podcast. You can also leave us a testimonial by following the link to the testimonial forms in the ecosystem by using the footer. Another way to support us is to share your favorite Dr. GPCR program with your network and colleagues. Email us with any questions and suggestions at hello@drgpcr.com. And until next time, stay safe.